20 million Americans suffer from some sort of chronic pain that can greatly interfere with their quality of life, leaving many to seek out treatment to help alleviate what they are going through. Joining us now is Dr. Oliver Hulland, pain medicine specialist with the Hartford Healthcare Eye Neuroscience Institute in North Haven. Thank you for your time this afternoon.
Thank you so much for having me. I really appreciate the opportunity to chat a little bit about all of the things that ail us.
Yeah, absolutely. Let's talk about how common chronic pain is and what types of issues you're seeing with your patients.
Yeah, I mean, I think that everybody experiences a backache here and there, but chronic pain is a really specific definition. And what it means is it's any pain that lasts greater than 3 months. And that was an agreement that came upon from looking at a lot of research and a lot of literature to say, this is something that isn't necessarily going to go away on its own. And, you know, by far the most common kind of chronic pain that we see are issues with the low back or the neck. And I think that those are really the things that end up impacting so many Americans.
So obviously it's something that you should be watching. And pain management doesn't always have to involve medication. What is involved when it comes to that holistic approach?
Yeah, I think that one thing that we have learned over the past, let's say, like 15 to 20 years, is that pain is tremendously complex as an experience. It's influenced from everything from our mood to what we eat, whether we're exercising, who we have supporting us at home. And I think that all too often we, even as patients, and as a patient myself, it's very difficult to sum up what pain means in a single number. And I think more recently in my training when I was at MGH, I learned that the modern ideas about pain have to do with trying to figure out how pain is influencing and affecting somebody's life. And the only way to do that is to have sort of a really holistic understanding of who they are as a person. What do they want to go back to doing? How can we sort of help them live a life that's filled with meaning and joy? And I think that focus is from a holistic approach. Now, I think I talk to my patients about mindfulness techniques, meditation, optimizing physical therapy, daily exercise, all the way to what I specialize in, which is certain interventional procedures and injections that can dramatically improve the amount of pain somebody's experiencing with a specific condition.
Yeah, it sounds like just being in tune with your body is obviously crucial and understanding what you're going through. Let's talk about technology now. Obviously, there's been so many advances in technology, but what about with this kind of treatment when it comes to pain management?
Yeah, I think that as the field has evolved and continued to grow, we have identified new technology that can make a big difference that doesn't necessarily require you take a medication on a daily basis. And I think for me, one of the most exciting things that's come out in the past 10 to 15 years is something called neuromodulation. And effectively, we use electricity over the spinal cord to disrupt the transmission and experience of painful stimuli in certain conditions. And that the most common thing that we see now is people who have painful post-back pain syndromes or diabetic neuropathy, painful diabetic neuropathy. And these electrical stimulation, these tools for stimulation of the spinal cord can dramatically improve the lived experience of patients who are suffering from that on a daily basis without having to take any medications.
Yeah, that's hopeful. Very interesting. And obviously, I'm sure there'll be more technology in the coming years and ways to approach pain medicine. So we appreciate your time, Dr. Hulland. Thanks for joining us this afternoon.
Thank you so much for having me.
Absolutely.